I'm a headache specialist at the University of Utah, and we will talk about how well do the headache devices work tonight. I have no financial disclosure to report. Before we start talking about the devices, by the way, we will be only talking about FDA-approved devices. Before we start talking about devices, let's quickly talk about how the devices are being produced and what's the idea coming from. So there is this treatment called peripheral neuromodulation, and devices are the part of peripheral neuromodulation treatment. The mechanism of peripheral neuromodulation is to help reprogramming of brain response to the pain. So by doing chemical or electrical or magnetic stimulation, we are trying to change the response of the brain to the pain. And the targets the structure not involved in headache pathophysiology like occipital nerves, phonopalatine ganglia, vagus nerves, preorbital or supratrochlear nerves. The branches of the trigeminal nerves have been used for this. There is electrical methods and there is chemical methods. Chemical methods are the ones that we use like in the clinic, nerve blocks, phonopalatine ganglion block, occipital nerve block, or supraorbital supratrochlear nerve blocks. When it comes to the electrical methods, then it comes to the devices. So before we start the first device, I just want to show you some of the nerves in the face. They are responsible for the sensation, and the two of them are important for us. For the next device is the supraorbital nerve, which comes right here. That's the eyebrow, and then the supratrochlear nerve. We are able to block this nerve blocks with lidocaine and bupivacaine in the clinic as a chemical neuromodulation method. And then there is a device called Cepali. It's a transcutaneous supraorbital nerve stimulator. And this device, through stimulating those nerves, it helps to neuromodulate. It helps to change the response of the brain to the pain. These supraorbital and supratrochlear nerves are the branches of trigeminal nerve, and trigeminal nerve is one of the most important nerves, and it comes to sensory input from face and head to the brain. The device, Cepali device, is the first FDA-approved device for migraine treatment. It was 2014. And there have been multiple studies showing the efficacy and safety since 2008. There have been studies only using Cepali device with patients with migraine and showing it's how effective it is to decrease the number of headache days per month and the severity of the headaches and improving the lifestyle. There are some studies comparing this device with the topiramate. There are a group of patients with medication overuse headache in some studies, and it's also being tried for patients who have low-grade migraine, and then for patients who have been tried and failed couple preventive methods. And in those studies, the main thing was the safety, especially the one with the topiramate. The Cepali device was shown to have superiority as compared to side effect profile with the topiramate. Patients were more compliant with the Cepali device as compared to topiramate because they had less side effects. When it comes to how effective it was, the decrease of number of headache days per month was significant statistically, but when they compare to topiramate was superior to the devices. Cepali device, when it first came out, it had this Cepali acute, then Cepali preventive, and then now we have this Cepali dual. Dual means that you have one device and then you can use the same device for prevention and for acute migraine treatment. For prevention, you have to use the device every day for about 20 minutes. And it has two settings. When you kind of press one, there is one setting, and then when you press twice, then the other setting kicks in. It starts with sending stimulation in low frequency, and then it becomes more if you wait. And when you feel like that's enough for me, you can press the device and it stops at that level. Cephali device has been shown to be very safe. The only side effects, the reported side effects, they were minimal, and they were mostly about kind of skin irritation and little tingling, maybe numbness on that area. But otherwise, it has been shown to be very safe device for migraine treatment. The second device approved was FDA is single pulse transcranial magnetic stimulation spring TMS device. When spring TMS device first approved in 2014, it was approved for migraine with aura. The way it works, you put the device back of your head, and it sends this single magnetic stimulation. And the idea is with that single magnetic stimulation, it reverses the pain response, and it helps for chronic pain. The most famous study for this device is a SPOS study from 2015. In that study, the method was using 4 pulses twice a day for prevention, and then for acute treatment, they were allowed to use it 3 times a day. The most common side effect for this device was lightheadedness. And after this, the study, SPOS study in US and in Europe in 2017, FDA approved the spring TMS device for acute and chronic migraine treatment age 12 and older. They did a study in adolescents, and the data only showed improvement maybe a couple days per month, but a couple days per month in the studies can be very effective when it comes to the actual life. So it was, the results were pretty safe. That's why they approved it for a young kid starting age 12. The only contraindication to use this device is the presence of other signal devices like a pacemaker or metal implant. The company was gone for a while. That's why we weren't able to prescribe this with this device, but they are coming back. I haven't heard from them, so we don't have a demo device in our clinic, but they are coming back to providing the device again for treatment of acute and chronic migraine. There's another device called GammaCore. It's a non-invasive vagus nerve stimulation. GammaCore device, one of the kind of main difference from the Cephali and spring TMS device, it was actually first approved for cluster headache. Then they had a couple more studies for using chronic migraine and acute migraine, and they now have the FDA approval for migraine treatment and cluster headache treatment. In both headache syndrome, they have the approval for acute and chronic treatment. The non-invasive vagus nerve stimulation works on the branch of the vagus nerve. You put it on your neck area and you send the stimulation, and it causes little pulse on your lip, and that means that you're on the correct area, and you can repeat the stimulation a couple of times, and it helps to stop the attack. And when you use it every day, it shows that it decreases the duration of cluster attacks and also decreases the frequency of the migraine. The study was done for migraine, wasn't very wide. It was very small sample, very simple study. So for migraine treatment, we need more studies when it comes to GammaCore device. I had a couple patients developed some voice changes with GammaCore device. We have the device in our clinic, so if patients, they want to try and see if that's something they would like to try, we are able to have them try in the clinic. It can be a good device because it can be used multiple times a day. It can be a good device theoretically for patients with medication overuse headache. Before we move to next device, I want to show you the occipital nerves. We have 2 occipital nerves. They kind of comes from the posterior part of a couple of cervical nerves, and one of them is the greater occipital nerve, and then the other one is the lesser occipital nerve. We have been using occipital nerve blocks for many years for treatment of cervicogenic headache, migraine headache, occipital neuralgia, kind of different headache syndrome. And now we have this device called Arrivia, and the Arrivia device is a device that stimulates both the supraorbital supratrochlear nerves of the trigeminal nerve, and then also stimulates at the same time the lesser occipital nerve. The device is not long enough to cover the greater occipital nerve, but it stimulates at the same time the lesser occipital nerve and then the supraorbital and supratrochlear branch of the trigeminal nerve. It's approved for acute treatment for migraine. The company said that they actually received the FDA approval sooner than what they expected. So the device is not widely used yet. I don't think it's available yet either. They were talking about maybe September that it's going to be available. You don't have to keep changing the device. They are expecting that the device will be able to use for about 2 years. You will pay it for once, and then you will be able to use it for 2 years. You will only need to change the patches you use with the device. They are also having some studies going on for this device to be used in depression and also for ADHD. Same thing with the magnetic stimulation devices, not the spring TMS device specifically, but same kind of methods, the neuromodulation, changing the response of the brain has been used and studied for depression, anxiety, and ADHD. Another device is called Arrivia, which has been available now. It's a remote electrical neuromodulation device. The difference of this device, instead of putting it on your head, you put this device on your arm. And the idea is inhibiting the pain by this modulation of upper peripheral nerves. And this device, it's again FDA approved device. It's better operated. You can use the device, control the device with a smartphone application. You do 45 minutes stimulation to upper arm, and then it decreases the migraine pain. And at the same time, it also decreases the most bothersome symptom. The result of the study shows very promising. 1% of the patient used additional rescue medication within 2 hours post-treatment. They were all allowed to take rescue medication, but only 1% they had to use or they needed to use a rescue medication after using the device. It's also approved for adolescents, 12 and 17 years old, and for adults at the same time for acute migraine treatment. They are for future, they are hoping to use the device for chronic migraine treatment as well. The only side effects were warmth sensation, numbness, redness, and some itching on the arm. It's available for patients. They are seen at a VA, and they are, I think they will be able to get the device with very low price, or maybe not even, and they will even need not to pay anything. It's not commercially approved for from the insurance companies, but VA will be able to help for their patients to have the devices very cheap. So if we summarize the result of this device, and so that was actually the title of the discussion, right? Do they really work? They are all FDA approved. The devices are included here. So the problem with the devices, FDA approval for devices, that it's easier than the medication. The requirements are easier, so that's why FDA approval for devices is easier than the other medications, the oral medications or the injections. Most of these studies for these devices are small sample size, and they have limited studies comparing with other medications. With like anti-migraine medications, we use commonly the topiramate, amitriptyline. If we have comparing studies, we can understand it better. And the patients included in these studies, we don't have very specific information or group of patients. So we have, when we talk about migraine, we are talking about patients with episodic migraine, patients with chronic migraine, and then patients with intractable migraine, meaning that patients who have a headache less than 15 days a month, patients who has a headache more than 15 days a month, more than 3 months, and then the patients who has chronic migraine, and then they failed multiple medications, multiple preventive medications. So the patient population used in these studies, they are very mixed. So we don't really have a good understanding what's the best population of patients that these devices are working. When it comes to safety and tolerability, it's very good results because most of the time these devices are tolerated very well, and patients are not complaining about the side effects. It doesn't affect their thinking, it doesn't affect their feeling. They have only maybe mild skin rash or skin sensitivity. Those are the common side effects. So when it comes to tolerability and safety, the other good thing is they don't cause any drug-drug interactions. There isn't any specific study I know about that I know about these devices and pregnancy, but we are assuming that they will be safe during pregnancy as well. And the other main problem is financial burdensome. So many of these devices, they are not, even though they are approved by FDA, they are not covered by insurances. So most of the time patients has to pay for these devices by themselves. And the other problem is some of them, yes, you buy them once or you pay them once and then you can use the device many years. But a couple of them you have to either change the device or you have to kind of load the device with monthly cards, which can be pretty expensive. So those are the main limitations about using the device. So what we do in our clinic is we offer our patients to use these devices when they come to the clinic, and especially if they have an acute migraine going on, so they can see the effectiveness of the device, and then if they like the device, then we can work with them and with the company, and then we can try to get the device for them. But again, the insurance, they won't pay for it, so the patients should be paying for them. That's all what I have. So I think we can start answering the questions if there is any.